Welcome back. The human body goes through a lot of changes during and after pregnancy, believe you me. So here with what we need to know about having children and what happens afterwards, maintaining good health for the long term, is Overlake Medical Clinics physical therapist Kathy Golic. It's good to have you.
Well, hi, it's wonderful to be here.
So people talk about getting the tummy area back in shape after childbirth. But that's not all. There's a lot of stuff that goes on after you've had your pregnancies and your childbirths. What is it we're particularly concerned about today?
Well, I guess I would say the tummy is just the tip of the iceberg. Really, we think about trying to get our whole body back in shape, be healthy and fit in a safe way. And really, I'm a pelvic floor physical therapist, and I like to really talk about this part of the body that people don't talk about.
Exactly. So first of all, I think most of us don't even know, what is the pelvic floor? What does that involve?
Well, the pelvic floor is the base, you can kind of think of the bottom of the core.
Okay.
You know, so I guess it really is a systems kind of approach. So if we think about the whole system being a core from the diaphragm at the top, the pelvic floor is that bowl of muscles and fascia that support our pelvic organs. And then the rest of the core is the abdominals and the fascia that wrap around us, the muscles that connect to the pelvis and the spine. So this whole system that contains our organs, and basically it's responsible for holding things in and also letting things out.
It's got a lot of work to do over the course of a woman's lifetime.
Yeah, and having a baby, you have to be able to, you know, open so you can have a baby, but then you want it to bounce back and hold things in.
And so it's not only right after childbirth, but then as you age, what are some of the problems that can occur?
Well, there's a lot of things. I mean, luckily and fortunately that most people recover pretty nicely after childbirth, but there are some issues that can result, and if they're not dealt with, yeah, they can present down the line. I call them downstream issues because...
Yeah. And you may ignore it now, but it'll catch up to you.
Right. So things like leaking urine, leaking gas, leaking stool, having the organ descent, that's a thing that's just now starting to be talked about, called prolapse, where organs will actually descend. And
I had never even heard of that until recently. And so is that just a problem that the bowl itself is no longer functioning and things are falling through, or what are we talking about?
Well, actually,
sorry to be so graphic.
Yeah, I know.
Let's get it out
you know,
there.
this is my world. You know,
yeah,
I live this stuff. But yeah, basically, things start dropping because some of the fascial systems get stretched, and gravity's pushing down. And there's things that we do like coughing and straining, like constipation's the enemy. Doing heavy lifting and sometimes even doing some workout things that we do can kind of push things down, and actually the organs can basically slide down into the vagina and out even. So we try to train the muscles and the systems to manage the pressures so that we can support and hold the organs up and in when we're going about our tasks, and we really want to try to do that throughout our lifestyle. So if we can catch it early, it's great. I see a lot of people that didn't catch it early, and 10 years down the line, they're finding that they are having some of these problems with, you know, maybe leaking gas or having a sensation of something dropping or something actually kind of sliding out when they're in the gym.
They have a surgical situation sometimes, right?
Sometimes they do, and surgery is a thing. But the fun part about being a pelvic floor therapist and becoming an expert in this is I can take people who are having this happen and teach them how to breathe, how to do activities of daily living differently, things to avoid, things to integrate, and bringing in and recruiting those muscles all throughout the day so that they can lift and support, and maybe not. I've seen many patients go off the surgery schedule.
That is awesome.
From getting their pelvic floor back in shape, basically.
Let's talk about what that regime looks like. What kind of exercises are we talking about?
Well, I always start with breathing because really you do
let's do it.
Yeah,
let's
you
breathe.
do it all day long, right? So naturally women tend to be a little bit more of chest breathers, but I try to teach people to learn how to connect with the diaphragmatic breathing so they let their belly rise and their ribs expand.
And you can do that by just placing your hand on your diaphragm, right? And making sure when you're taking in air that you're actually expanding and it's not just this.
That's right. Not this chest breathiness. Exactly. So the diaphragm will drop, which makes a vacuum, so you want to fill your lungs. And when that happens, the belly should expand. We want it to be natural and allow it to expand like a new baby would or a puppy. You can see it moving. So we let that happen, and actually the pelvic floor will relax a little bit with this inhale. Then it sets it up for a nice piston kind of response where as we then exhale, things will kind of recoil back to the midline. So inhale, exhale, and then I teach people how to basically capitalize on that natural business and recruit intentionally bringing those belly muscles back to the midline, the deepest layers. And we really, it's about training so much at the beginning, not strengthening, but learning to connect with our nervous system and the control, and getting this connection of being able to close those deeper layers, and then the others follow. And so as we go through the day, imagine if we can do inhale, exhale, and really focus intentionally on pulling those muscles closed. It's nice for bringing back the separation that also occurs after, for some women.
Right.
That may not, maybe in 2/3 it comes back, but some people, those muscles don't come back, and we
Right.
can really intentionally bring them back with recruiting and then bringing it into our workout and our activities of daily living.
Now, when you say that you train people to do this, is this something that I have to sit there and be cognizant of, or will I learn to do it and then start just doing it naturally?
Well, my goal is to help you learn to do it naturally. At the beginning, it is a training thing. It's like taking the brain and making that connection. So that's why I use this visual of thinking about the elevator doors, because EMG tests show if you actually are thinking about it and focusing on it, they will show that you are actually recruiting the muscles. In real-time ultrasound, you can see the muscles actually engaging.
Right.
So we start doing that, and then I get people to, like you say, feel it, and I have them learn to feel the downward gentle excursion of the pelvic muscles at the same time. And then you're sitting on some of the pelvic muscles, so you can think about lifting up and in. So not only am I bringing in this muscle business from the belly, but bringing up and in the pelvic floor muscles, like as if you're stopping urine or holding back gas. So we're kind of bringing in those muscles at the same time.
And
Does that
getting
make
them
sense?
all to cooperate.
And getting them to
Absolutely.
cooperate and making sure we relax completely between each one.
So you'll hear women say from time to time, you know, that they laughed really hard, maybe leaked just a tiny bit. Is that then a sign that let's go and see about what the therapies are?
Yeah, it is, and it's, you know, I'm so glad to actually get a chance to talk about this, because I get so sad to see the commercials for all the pads for young women, and that's
we
not
can
the
do better.
first line of defense. That, you know, the pelvic floor exercises and learning to recruit these muscles are extremely effective in helping. That's called stress incontinence. And, you know, this whole thing, again, with the breathing and then integrating it with things that we do, working out, walking the baby in a stroller. Even you can do those pelvic floor ones with nursing, and it really reduces the risk of stress incontinence. But there's another little bad boy called urge incontinence, which is a misbehaving bladder, and that's something that's a little bit different because it's the autonomic nervous system. But, you know, I help people to address that too with bladder retraining and behavioral changes.
Well, the good news is we can do something about
There's
these
so
things.
much that we can
Women's
do.
bodies are amazing. We can do things with them. We don't have to wait till...
We don't have to live with it, right?
Thank you so much.
Yeah.
Appreciate it. To learn more about pelvic health and the other services offered at Overlake Medical Center, please visit overlakehospital.org or New Day's website, and we can link you over. Up next, a wellness program to reverse chronic disease. We'll be right back.